The start of 2021 has not been one that any of us have been hoping for. We're very much in the midst of the pandemic, and it is at a very serious stage, with a new variant of COVID-19 with increased transmissibility, high level of hospital admissions, and a new national lockdown. The college has issued a statement to help members understand how this will affect practice and confirm how patients should continue to be prioritised. We recommend that practices continue to follow the AMBER guidance, and I want to talk more about that, but first I want to make the really important point that following the AMBER phase guidance does not mean continuing with business as normal. Every practice needs to consider carefully balancing the risks of offering routine appointments to asymptomatic patients and defer appointments according to your professional judgment. The government guidance in all 4 nations is clear. The NHS should stay open, and in accordance with that government advice, in all parts of the UK, people can leave their homes to access health services and should continue to access primary care optometry. It remains safe and open. Last March, at the start of the pandemic, the college recommended that practices stop routine care because we believed it was not safe to continue. There were shortages of PPE, limited knowledge of the disease, and practices simply they weren't set up to deliver care in a pandemic. The college was not afraid to stand up to industry and employers and ensure that patient care and optometrist safety and well-being were put first. Throughout the pandemic, we have continued to champion the importance of optometrist-delivered care and the importance of the routine sight test as an essential public health function, and we will continue to do this. However, now we're in a very different position to where we were in the first lockdown in March. Optometry is open and safe because of the hard work and tireless efforts that you have all made to transform our working environments, to use PPE, adapt our routines, and to screen and prioritise patients before they enter the practice. Optometrists have also already started to receive the vaccination in all 4 nations. The profession's compassion, dedication and tireless efforts to help people and support the NHS throughout the pandemic has been truly humbling. One of the biggest priorities now for each healthcare system in the UK is to ensure that as much of primary and secondary care stays open for both essential and routine care. Why? Well, to ensure we minimise the impact of non-COVID-19 related health problems. For optometry, this is as important as it is for any other area of primary care. We know that, regrettably, when people did not access eye care services during the first lockdown, less disease was detected and people were seeing less well, and some people have been affected by permanent visual impairment that was preventable. We cannot let that happen again. Since we made our statement earlier this week, we've been contacted by some optometrists who do not understand our recommendation to continue to follow the AMBER guidance. In particular, I have spoken to people who are concerned about providing routine care. Based on these conversations, there's 4 key areas I would like to address and explain further. Firstly, when will there be a red phase? This will be initiated when and if a national government or health system suspends all of primary care services. However, we are now at a very different level of preparedness than we were in the first lockdown last year. We believe it's unlikely that any health system would now shut down primary care again, even in the highest alert level, the AMBER phase. People have asked, am I safe in practice? Well, Public Health England have looked at the risk of the new strains and continue to recommend existing PPE and IPC. We regularly review their advice, and if there's any change in the guidance, we will share this immediately. The safety of our members and of the public is our number 1 priority, and have no doubt we would speak up again as we did last year if we believed that PPE needed to be changed, or even if practice needs to be paused to ensure your safety. People have asked what about the stay-at-home messaging? Well, each nation's government has been very clear that people can leave their home to access healthcare, and that includes routine appointments. People have also been very concerned that their employer is not following the guidance, and each registrant needs to be prepared to challenge their employer if they are not taking this pandemic as seriously as they should, and raise concerns through the correct channels. The sector bodies are about to release some more guidance on this. The GOC have also helpfully provided a new guidance consultation on raising concerns and whistleblowing to further support and strengthen registrants. The Amber Phase guidance has never meant business as usual, and we and each nation's health service are very clear on this. Optometrists should prioritise emergency, urgent and essential eye care on a needs and symptoms-led basis. Routine appointments should only be provided if capacity permits and if it's in your patient's best interests. You should offer telephone and video reviews to your patients in the first instance to determine their COVID-19 status, their level of eye care need, and you should also weigh up the risk of their health attending a face-to-face appointment, particularly if they're shielding or a clinically vulnerable person. We recommend that asymptomatic patients should be advised of the importance of reduced contact and offered the choice and opportunity of postponing their routine examination until restrictions are eased, particularly if they're at one of those high-risk groups of being affected by COVID-19. Again, I stress that every practice needs to consider carefully the balance of risk in offering routine appointments to asymptomatic patients and defer, when possible, according to your professional judgment. We've transformed the way that we practice. We remain open, practice remains safe to deliver eye care, and that's something really each and every optometrist should be proud of. However, at this crucial junction, we need to continue to play our part in protecting and improving the nation's eye health. We're respected and important healthcare professionals, but that means continuing to provide care safely and meeting our patients' needs throughout the whole of 2021.